Here is your question. Right. If you have read and understood, considering it history taking station, kindly begin.
I'm entering the station, washing my hands. Good morning.
Yes, good morning.
Myself, Dr. Jatin. I'm one of the surgical trainees. May I just confirm your name and age, please?
My name is Peter, age 64 years.
Nice to meet you, Peter. So today I'm here to ask you some questions regarding your illness. Is that okay with you?
Yes, it's okay.
Okay. Can you please tell me what brings you here in the hospital?
Doctor, I pain in my tummy and my bowel habit. I'm not going to toilet for last 2 days, and also blood is coming in the stool. And this happening for the last 6 months, but pain is for 2 days, and I do not like to eat, and these are the problems with me.
Oh, I'm really sorry to hear about this. It must have been very difficult for you. Can I ask you more questions about this illness?
Yes, sure.
You mentioned that you're having bleeding in your stools. And can you tell me more about that? I mean, what's the color of the stool? What's the color of the bleeding? Is it a cherry red or a dark red?
Doctor, it is something mixed with this stool. It is brownish type, and sometimes it is reddish without. I don't understand what is the problem.
Okay, so it's mixed, right?
Yes, mixed.
Okay, so is this blood present all the times, or it just comes and goes away?
Sometimes there is no blood in the stool.
Okay, so it's on and off, right?
Yes, yes.
Okay, so can you please tell me, have you noticed any mucus, slimy discharge along with the blood in the stools?
No, no.
Okay, okay. And you mentioned that you're suffering from the tummy pain. Can you please point? Yes, can you please point me to the site where exactly do you feel this tummy pain?
It is my center of the tummy, or on the left side of my tummy.
Okay.
Lower side.
Okay. And can you please describe the pain for me, whether it is dull aching, sharp shooting, or colicky pain?
It is colicky pain.
Okay. So is this pain present all the times, or it just comes and goes away?
Comes and goes away.
Okay. And does this pain goes anywhere else, like to your back or to your tip of your shoulders?
It may, sometimes it radiates to my whole abdomen, but mostly it is on my left side or center of the abdomen.
Okay. All right. And is there anything that makes this pain better or worse?
When I pass a stool with fresh red blood, it is relief. But when I eat food and unable to go to toilet, it is worse, doctor.
Oh, so sorry to hear that. And you also mentioned that you're suffering from constipation from last 2 days. And
Yes.
have you ever suffered opposite to it like you're going more often than the normal? I mean to say diarrhea.
Yes, you are right. Previously, it was that sometimes I have more loose motion 2 to 3 times. Sometimes I have no motion. Yes, you are right.
Okay.
There is alteration in my stool
Yes.
habits.
Okay. Okay, so have you ever noticed that uh, uh, have you ever noticed that you lost some weight unintentionally? You lost some weight, and there is a loss of appetite.
Yes, I check my weight. It is approximately 10 pounds decrease. And I also do not want to eat.
Okay, okay. And have you noticed any mouth ulcers, painful red eyes, muscle pain, or joint pains?
No, no,
Okay. And have you noticed any bleeding coming from any other part of the body?
no,
Okay. And have you noticed any swelling or itching around your back passage?
no,
Okay. Have you recently traveled to the abroad?
no,
Okay. Did you experience fever or episodes of vomitings?
no, no.
All right. Okay. So can you please tell me, have you ever met GP in the past for any other medical illness like diabetes, mellitus, or hypertension?
Yes, my blood pressure is high and I am on medication by my
Okay.
GP.
All right. So can you please remember the name of the medicine?
I think it is tenormin.
Okay. And do you remember the dose?
I take 5 milligram tenormin daily.
Okay. Apart from them, apart from this, do you take any blood thinners?
No,
Okay. Have you ever undergone any surgeries in the past?
no.
Okay. Can I ask you some personal questions?
Yes, sure.
What is your occupation?
I am electrician, doctor.
Okay. And with whom do you live at home?
With my family, wife and children.
Okay, that's good. And do you take alcohol or do you smoke cigarettes?
Yes, I am a smoker. I use 20 cigarettes per day, but I am not alcoholic.
Okay. And for how long you're smoking?
For the last 35 years.
Okay. And is there anyone in the family having a
Okay.
history of cancer?
Summarize
No, no.
your history taking now, please.
Okay, thank you so much for this.
Thank you.
If time would have permitted me, I would have asked for the idea, concern, and expectation of the patient and systemic review.
Yes.
And Mr. Peter, 64-year-old male, presented to me with the chief complaints of bleeding per rectum, which he is experiencing from the last 6 months. And along with that, there is a pain in the pain abdomen, and bleeding. It is mixed in color, and it is present on and off, and it is mixed with the stools. And the pain is usually in the left left lower side of the abdomen, and it is colicky in nature, and there is a no radiculopathy of the pain. So and also there is a positive history of loss of appetite and loss of weight. And there is a the patient is smoker, and there is no history of mouth ulcers, painful red eye, muscle pain, or joint pains. And there is a positive history of alteration in bowel habits, diarrhea, and constipation. There is no history of fever, vomitings, or any foreign travel. There is no history
Okay.
of any.
Considering your history, what is the provisional and differential diagnosis?
So based on these findings, my top differential is colorectal cancer, and my second and my other differentials are inflammatory bowel disease, diverticulitis, and any local anal causes like hemorrhoids or fissure or bleeding disorder or any bleeding
Okay.
disorder.
What is the most important investigation that you'll carry out?
Well, if I'm suspecting a colorectal cancer in this patient, I will go for the colonoscopy plus minus biopsy of any suspected lesion.
Okay.
And yeah, and
Any
to
other
rule out,
investigation?
yes, ma'am. To rule out the other causes, I will first do the abdominal examination and distal rectal examination, and then I will proceed towards the routine blood investigations, which will include CBC, LFT, KFT, urine electrolytes, and some specific investigations to rule out other differentials. Like if I'm suspecting infection, I'll go for ESR, CRP, blood cultures, and stool analysis. And if I'm suspecting any bleeding disorder, I'll go for the bleeding coagulation screen, which will include BT, CT, platelets, PT, and INR. And then I will go for to rule out anal causes, I will go for the sigmoidoscopy And then colonoscopy for the inflammatory bowel disease or diverticulitis.
Yes,
And
even the stool cultures.
stool
Good.
culture.
Thank you. Did you ask the amount of blood?
Ma'am, the patient said mixed with the stools. It comes mixed with the stools.
Okay, but didn't mention how much. 1 teaspoon, 1 drop,
Yes.
or half cup.
Yes, ma'am.
Nothing like that. Okay. Good. Thank you.
Thank you, ma'am.